Have you ever had a client that you use all your tools with, both manually and exercise-wise, but the pain is still there? Ever wonder if the pain is really physical in nature or if something else is causing the pain? In today's podcast, I talk with Justine Calderwood, a physical therapist and IBH certified birth healing specialist and the owner of the Healing Spot in Colorado Springs, Colorado, about her practice. I specifically wanted to know how she is incorporating the advanced techniques she learned through the IBH courses to help her clients and what she's discovered in doing this work. Listen in to learn about the client we discussed and the treatment Justine used to help her client. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode of the Birth Healing Summit podcast. And today I have with me Justine Calderwood. She is a physical therapist down in Colorado Springs, Colorado. She owns Healing Spot Physical Therapy, and she is probably one of my earliest students to get certified. So welcome to the podcast, Justine. Thanks for being here.
Thanks, Lynn, for having me. I really enjoy talking to you anytime I get a chance to.
Me too. Me too. So I was so grateful when you said that you would be willing to share a case study with us on using more of the intensive advanced techniques that you've learned in your studies with me. So Justine is a certified birth healing specialist. She's taken all the courses and all the testing and everything. And I have to say, you use it. It sounds to me like you use this work so beautifully in your practice. And I know you have a myofascial release background before coming in and taking all my courses. So I think you took to what I was teaching like a duck to water because it just came very naturally to you. So let's dive into this case study that you want to share with us. Tell us about this person.
Yeah, so I'm working currently with a gal that is, let's see, she's currently 32 weeks pregnant. She came to me when she was at 24 weeks pregnant with a lot of right-sided lower back and SI joint pain.
Okay.
She had a previous history of a right hip surgery and ACL reconstructive surgery twice on the right side. So that was part of her history. Okay. She was having right-sided.
Is
Yeah.
this her first pregnancy as well?
First pregnancy.
Okay, great.
Yep. First pregnancy. Actually met with her and her husband because he was very concerned. He's like, when she's in pain, she can't do anything. Like they were just, he just such a sweet couple. Like he was just so concerned about her and her well-being. And of course, baby boy that's on his way. And so met with them, did a consultation, and then we got started back in May 2023. So now we are in August. So I've been working with her for a few sessions. And she was having, just a lot of pain with sleeping. She was having pain with her job. She has a desk related job. She was also having some urinary leaking, frequency with urination, which, kind of comes with the territory, but still, what can we do here? What can we balance out? What's going on?
Yeah.
So with her, I got started. She was very much high on that right side. She was very compressed on the right side.
Iliac.
High, so like an upslip. Yeah, iliac crest was high. Okay, and she was also anteriorly rotated. So that was part of what I saw with her. So I suspected, okay, I want to kind of get into the psoas if I can, and what's going on around this hip and SI joint. Well, she was very stuck down in her SI joint. Right SI joint was not moving very well at all. And from what I could tell underneath, like ischiums, iliums, they weren't moving a whole lot. Okay. So we got
compared to the left side, right?
Compared to the left side. Yes.
Compared to the left side. So that's with these techniques, we're always comparing left side to right side. And if it moves well on one side, it should move well on the other side. So right side is not moving. Okay.
Yes. And she was tight into her like right paraspinals, into her low back, into her thoracic spine. It was just that side was just really drawing me in. And it wasn't a surprise that that's where she was experiencing pain. So we got started with some sideline releases, trying to open up this whole right side, get that ilium down. And, I was working on the psoas, just all the things related to, say, pelvic mobility. I checked uterine mobility with her as well. She was tighter on her right uteral sacral ligament, tighter on the right, like lower abdominal fascia, just again, everything into that right side.
Do you find that the baby was more on the right-hand side?
Yes. Yep. And she was like right away, yeah, he always sits there. You could tell even just with looking.
Yep.
I always start with my patients in standing and I just look and I'm like, oh yeah, you could just tell he was just hanging out over there.
Yeah.
And she said, yeah, she confirmed that. That's basically where he always is. And so yeah, just a lot of signs, right?
Yep.
So let's see. I started with just a lot of manual work with her, like I said, around the pelvis, getting the sacrum, ilium, all that to start to release and move better. Worked on uterine mobility, all of this external. And even after the first session, she came back visit two, and she's like, I already feel better. Like I don't want to go into all the techniques, but like I know she told me I'm having a hard time sleeping. My hips hurt, that right hip hurts, my right low back. So I did a lot of the sideline stuff, right, to rebalance things and get the
Okay.
iliums moving.
Yeah. So
Yeah, and
I just want to share everybody because I teach a sideline technique and I tell my students, I'm like, if any of your clients come in saying that they cannot lay on their side, you have to do this technique. And it's kind of a in flare, out flare kind of rebalancing is what we're doing in that sideline technique. But I find it as well that if someone can't lay on their side, you do this technique and then was she better after doing
she
that?
was better. And I always check both sides, like, okay, now flip over. So even though all her stuff was on the right, always check the left. And I don't
They're
always find things just on one side. It usually, I say, ping pongs back and forth. And I treat what I find. And so yeah, and what I loved about this particular patient was she could feel the things. I would just doing that gentle compression and she could feel it releasing and
Isn't
softening
that
and letting go.
fun? Isn't
I
that
love it.
oh,
Yes.
yes, yeah. I
Yeah.
had a patient yesterday that I was doing, I was working on a round ligament, okay? And I could just feel the tiniest little, releases underneath my hands. And she would go, ooh, ooh. And I go, oh, you're feeling that? And she goes, yes. So
Yes.
it's just so much fun when your clients can really sense
Yes.
releases that we're sensing underneath our hands too. It just makes it so much fun. Yay.
It does. Yeah. Yeah. There's always times where people don't feel it. And I'm
Right,
like, okay, you're just going to have to
absolutely.
trust me. And
Yeah.
I just have to stay super grounded in that I know I'm doing the right thing. But
Yes, yeah.
it is so much more fun when they are like, yeah, especially when the ones that can feel the very subtle
The
releases
mic.
and they're like, wow. And they start telling me, all kinds of stuff. I'm like, I
Oh,
love this. It never gets old.
yep, yep, yep.
Yeah.
Cool.
So I want to mention a couple sessions ago when I saw this patient, because I was doing the normal, pregnancy related techniques that you teach in your classes. But what came up for her, she came in and she said she actually had kind of like she had been doing really well. Every session was like, I'm feeling better. And then there was a period of time, I have to look here between our sessions. So let me see. Okay. No, actually, it was like 10 days.
Okay.
And something changed. She came in and she said, I'm in a lot of pain today. And I was like, huh, what's going on?
Yeah.
Like what has changed? So we're trying to dive into that. Are you sleeping any different? Has something changed? And she said, well, I have a trip coming up for work and I don't want to go. And so she said she's having some kind of um inner turmoil, I guess, with her job on whether that she wants to continue to work after baby comes, but they haven't been super supportive for her during this pregnancy, and they want her to leave the state to go travel for 2 weeks time. And she's like, I just want to be at home. She's in her last trimester. She's like, I'm not comfortable, but I have to do it, and they're kind of forcing me to do this. So she came in, and that was what she told me about what was going on.
Yeah.
And so
And,
again, I got to work checking
and
things.
so,
Go
yeah,
ahead.
her right side pain was
Yes.
worse. Okay.
Yes, her right side. Yes, and I could pinpoint it, that right side. She's like, "Yes, that hurts. Anytime I touched it, anytime I would try to mobilize it, that's where it hurts." I mean, it was very pinpoint, and so it's like, okay. So I did my just physical things, right? And
Yeah.
it really wasn't budging. It wasn't changing a whole lot. So I said, "Okay." And to be honest, I don't even know what I was doing at the time. I don't know if I was internal or if I was external, but this
Right.
was what was profound is that when I was working with her, I'm like, "Okay, let's have you go in here. What are you sensing in here? What are you feeling? What could this be about? Just get curious with it." And I just held space. If I looked at my note, I could probably tell you where I was, but um anyway, so I'm holding her body in some way, right?
Yep.
And she tells me, "Oh, yeah." Well, actually she started crying immediately when she came to the answer, and she said, I said, "Well, you can share if you want to. You don't have to, but I can, if you share, I can kind of guide you a little bit better." So she said, "I just feel so stuck. I feel so stuck in this job." And I said, "Huh, interesting choice of words, because that's exactly what she was telling me. Her right side felt stuck. I just feel stuck. I feel like it's not moving." And then she had the same language with, "I just feel stuck in a job that I don't like." And then, I guided her through that using some of the advanced techniques that I've learned from you, how to hold space there and how to do some of that dialoguing and getting into those tissues a little bit on a different level than just physical, right? And
Yeah.
she was worried about finances and allowing her husband to kind of provide for the family as baby came. And so I just held space for that and helped guide that. And sure enough, I could feel it releasing. And then when we checked in at the end of that session, she was 75% better walking out of my room. And no, it wasn't 100%, but we made so much change. And I knew that we had kicked some pebbles loose that could
Yep.
then continue on. And she was at the heart of the problem that she could then come to terms with. And I gave her some homework on just sitting with that and letting that continue to come up. What do you want to do about that? You don't need to make a decision or take action today, but just coming to that awareness of, this is kind of the heart of what's going on. Now you're in a position where you can make some choices about it.
Awareness is
Um,
always that first step, isn't it?
yes.
They've gotta be
Yeah, it's
aware of what's
incredible.
held it. Yeah, I love that the term "stuck." I just feel stuck, you know? Well, yeah, your body's stuck too, and our body tells the story. It so
Yes.
shows up and tells the story of what's going on in our life when we know how to look and listen and understand the roadmap of the body. And the reason I, clarified that her pain was on the right side is because the right side of our body it represents our masculine energy. And that's about putting ourselves out into the world. It's about doing our work out into the world, or it could also be about relationships with men. But for her, it was obviously her doing her work, moving forward with her
Mhm.
work in the world. Yeah.
Yep.
And so,
It's interesting too, because sometimes she does have some left side stuff that pops up. And I remember too, with dialoguing with her, some of it, what came up was she wants to be a good mom. So some of that left sided energetic stuff came up as well, and she was feeling some discomfort over into the left lower back, pelvic floor area, and telling me, we explored that as well. Like, what could that be about? Well, I want to be a good mom.
yeah,
And I know, just based on the work that I've done with this particular patient, that she's got a relationship with her mom, and it's okay. It's not super like problematic, but there are things that I know she has shared with me that she wants to do things different than what
mm,
her mom raised her. And so I think there's a little bit of that pull of like, okay, this is how I was raised, but I want to do it differently. But mom still wants kind of a little bit of a voice and be able to guide her, and she doesn't really want that. So that's also some of the things that we talked about, like, what does it mean to be a good mom, and
yeah.
what does it look like different for you, that you can allow yourself to come up into that feminine energy and allow a shift. So that was
I,
pretty powerful too.
I think the most important thing that we can help our clients with is to help them understand that that left side of their body is that input. It's that feminine receptivity of what they're desiring, what they're wanting, and really the roadmap of how to do it. And then the right side is actually the implementation side. It's doing it. But how we do things actually comes from our left side, or if we
Mhm.
really listen, and
Yeah.
having that nice balanced energy between left and right side in that pelvic space is so critical, especially for new moms, to
Mhm.
help them open up to really listening to that instinct, that feminine intuition. It's so powerful for them, especially for dealing with their kiddos, and that mother knowingness of what their baby, what their kid needs. If we can help them tune into that and own that more, I think the big thing you did here, Justine, was just help her to tune into it, to see what's being held there,
Mhm.
like, and giving
Yeah.
them permission to go there.
Yeah.
Um,
Yeah, and listen to their own, yeah, intuition, their own calling, and
Yeah. And so were you able to, because one of the fun things that I love the most is when someone is talking and they get on that right topic or that right issue, the release of the tissue, like
mhm.
the softening of the tissue. And
Yeah,
I,
I feel that a lot. I'm sure I felt that with her too. Yeah, I do feel that a lot. And if
yeah,
they're not on the right, it just stays. It's
yeah,
stagnant, or it
right,
just
right.
stays like where
Nothing.
it's at. And
Nothing shifts. And I love that you said that I address everything on that physical level first too. And you were trying to get that sacroiliac joint to unstick it, right? It was
mhm,
stuck, it wasn't moving. And so, you're trying to do everything you do, but nothing was making a difference. You weren't getting that effective change. And to me, that is an ultimate sign that it's not a physical issue,
mhm, yeah.
that there's either energetic or an emotional issue holding that in place, holding that stuckness there. And if we want to be as effective as we can be for our clients, we need to become comfortable being able to go there and
Mhm,
to be able to just hold space, like you said, to allow them to explore. It didn't sound like you were guiding her to one thing or another. You were just letting her kind of explore possibilities within her, right? In her
yes.
dialoguing.
Yeah.
So
Yeah, and picking up on how she was saying the language, even just saying, "Huh, that's interesting that you're using that word 'stuck.'" 'Cause isn't that what you said about your hip? And just helping her sometimes to connect the dots, but not leading her or overbearing and telling her what's going on,
no, yeah,
because that's not my role. And honestly, I don't always have that intuition of this is what's going on,
yeah,
It's
yeah,
they have it within, but I can sort of, guide it based on, I don't know, I think that just comes with experience as well. And
yeah,
possibly I've done a lot of my own healing work, and
yeah,
so, I
yeah,
think that helps as well to
absolutely.
hold space for my patients, of course.
Yeah,
But yeah, never guiding them in that sense of like leading them or telling them this is what's going on,
yeah,
letting them
yeah.
come up with it. Yeah,
Right,
feel into
right.
it.
Yeah. It's amazing how much what people say is so spot on. And
Hmm.
and for us to, but people say it and they just kind of disregard it though, right?
Yes.
And for us to be like, wait a minute, that was important. Let's go back to that.
Mhm.
What did you just say there? Let's explore that a little bit more. What do you mean
Yeah.
by that? What,
Yeah.
like just getting curious with what people are saying and having that ability to dialogue with someone and be able to pull it out of them, right? Because our dialoguing, there is an art to dialoguing and asking questions that are not they're more open-ended, more
Hmm.
exploratory questions. One of the principles I teach in my birth healing intensive is that that we want to stay away from why and how questions, because that leads us right into our head. And if we can phrase things in more of a what question, that it keeps people more connected to their body, keeps them out of their head more. They don't get as defensive. And so, and I love, Landy Peak told me that when she learned that in the class, was Landy in your class when you,
Yes.
yeah, yeah.
Uh-huh.
So, Landy said she started using it on her kids, and it was just, she found a huge difference in interacting with her kids using what questions versus why did you do that? You know, can you hear, why did you do that versus what made you do that? You know,
Mhm.
it creates more of a curiosity versus a blame. And so she found it really, really helpful bringing it to her kids. And so there's
Yeah.
that, the dialoguing and just allowing ourselves to stay curious with our clients and allow them to bring curiosity and not judgment, because
Mhm.
judgment is a big piece that can kind of stop the process. But staying curious with what's going on in the body is so, so helpful. And
Mhm.
I, I
I was
find it
going to see if you find this with language with your patients. If I'm trying to get the, okay, what's your, like, what's your body trying to say? Or what could be in here? What could this be all about? And when they reply with, I think, I think it's this, I'm like, no, that came from your head. Yeah, let's try to let your body speak. And, just it can be at first, it can feel a little awkward to give them that space and time that they need to actually explore that. And then they'll come up with something totally different. It's like, oh, it's this. It's like, yeah, when you're coming from that thinking mind, you're guessing at what it could be based
yeah,
on logic instead of, well, what actually is it based
yeah.
on your body's wisdom? And it is different.
Totally. You're talking about the head response versus the body response. You know, like
Yeah.
what the head says versus what the body says. And
Mhm.
as a therapist, you can start to discern the difference of, like, oh, that totally came from your head. Okay, let's say, let's answer from down here, come down to my hands and let's see what this area of your body has to say versus what your head just said there. I totally feel that too. And it's
Yeah.
so cool, Justine, to be able to discern that, because what I say, and that's why cognitive behavioral therapy, where we're just doing talk therapy, is only going to get you so far. And that it's just trying to figure things out from a head level. Well, it's so much easier to figure things out from the level at which it originated. And
Mhm.
a lot of times stuff originates in our bodies, and coming down and connecting into the tissues of the body, that's where the wisdom lies.
Yeah.
And the responses, like you said, are so night and day.
Yes.
But to be able to really discern that as a practitioner, like, oh, that just totally came from your head. What does
Mhm.
this part of your body, and especially working in the pelvic space too, right? Because
Yes.
Tammy Lynn Kent talks about the root voice, the voice that comes from our root, which is that pelvic space, deep in that pelvic space.
Mhm.
And there's an art to saying, not putting someone down, like, no, that's not it, like, what else could it be? Let's
Right.
go deeper. Like, that might be what your mind is thinking, but I wonder what your body is feeling, and using those terms too. So yeah, awesome. Well, thank you so much, Justine. This was so amazing. We could talk for hours on
Oh, we
this
could.
though,
Yes.
right? Yeah. So I just
We'll have
want
to
to
do
thank
another interview.
Yes, we will. We will, I'm sure. So thank you so much for your time and sharing this amazing, amazing case study with us, and how this work can really help shift when things aren't shifting physically. We got to go deeper, everybody. We got to help them to tap into what's really going on in that area. So thank you, everybody, for listening in. Thank you, Justine, for being here.
Thank you.
We will see everybody on the next episode. Here's to smoother births and faster recoveries, everybody. Take care. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.